Hello, my name is Dr. Scott Young with Hearing Solutions Centers, and today we're going to talk about speech understanding in noisy situations. Coming right up. Okay, so if you've been a part of this series, I'm going to set this aside, don't really need the notes there. We've talked about the audiogram. That's the first one where you have the big box there, okay? And you have the little readings. And what that is understanding what your right and your left ear does for the tones to know the different pitch areas, okay? And that's why we isolate your hearing and understand the range of your hearing problem. The second thing that we did is that we were talking about speech understanding in quiet situations. So what we're trying to do when we have speech understanding in quiet situations is we want to know the maximum capability of your understanding in your brain to hear and understand the words. So for instance, a person can have a hearing loss, but they have 100% speech understanding. It means loud enough to hear it, but they understand pretty darn well. Then they can have a stroke, which compromises sometimes, not all the time, but sometimes compromises the left hemisphere. When it does that, it affects the understanding of speech. And so a person could have 100% understanding and drop down to 60% or whatever, and it becomes a big problem. So we have those kinds of possibilities. Now, that's just a part of the role. Now, some people do those two tests. Most of the people are supposed to do at least some of that stuff in the testing, but they don't do it all the time in speech understanding and quiet. Sometimes they mess up what they do. Now, what we're going to talk today about is speech in noisy situation. Oops. Sorry. Okay. Now, when we understand speech in noisy situations, what you have to first do is realize a couple things. Now, we're going to talk a little about how we test it and what we're kind of doing, but I'm going to show you in a different kind of way. So what we do is we want to have loud enough, the loudness to be loud enough so that you definitely can hear and understand the words. Now, some people don't test it loud enough. If you don't test it loud enough, you will not get a good reading. And again, we're always looking for what's called PB max. Now, some of you won't know what that is, but it means phonetically balanced, meaning I can hear all the stuff and I want to get the maximum ability to understand those words, okay? So I'm going to get up to a significant level, which is going to be way above your understanding. Now, it might be a little bit loud to you. And you might go, that's just kind of loud for you. And I'm like, I understand, but I need to do it this loud. So we do these speech sentences. Different kind of words out there are different kinds of ways that they do this, but these are balanced words so we have an understanding. And then we score that based upon different ways. So one of the types of ones that we'll just sort of talk about that one because it's easy to do is called the quicksand. That's something that I like doing, and I've spent a lot of time with etymologic research who actually did this because they didn't like some of the terminology they had. What they said is 0 to 2 is normal. So if you got everything but just like 2 words missing of the right kinds of words we're looking for in these 5 sets of sentences, and you only missed 1 or 2, well, you're in the normal range, okay? So again, we're trying to do it loud enough to see your normal ability to understand in noisy places. The next level actually is called mild, but I hate the word mild with a purple passion. It's because nothing in the world is mild. Now, if I got a mild cut, I never even really put a Band-Aid on, so why am I going to worry about it? I mean, sometimes I get a mild, thing of a hangnail kind of thing. It's kind of a mild infected point. I might put like some, antibiotic ointment and put a Band-Aid on it, live over, stay overnight and it goes away, right? That's mild. I hate that word. So we actually call it is a moderate problem. Or excuse me, said that wrong. We actually call that some problem understanding. And that is anywhere from 2 to about 7. When you miss 2 to 7 words, I say you have some problem understanding and noise. And you go, yeah, that's about right. Now with my hearing loss, I score easily in that range, okay? Even though I have better hearing than that, I go farther into this range. I'm going deeper into this realm. You can't test me because I've already memorized the words, so I'm not really easy to test in that way. I'm a wacko when it comes to testing. It's just what happens when you know the testing regimens so well. But that's where you would have some problem understanding. The next one I call significant. Sorry, there's an I there. So that's anywhere from 7 to 15. Now 7 to 15, when we say I have a significant problem, that means you're having real troubles understanding in noisy places. And when you go into those places, we'll explain those a little bit more. And then I use the last one where they call it profound. I just call it extreme problem. And that is 15 and beyond. Okay? So these are a little different than some audiologists will look at this way. This is something that I actually normed. I looked at, I checked with the people so they can know that this is accomplished. This is an effective way of saying it. Now we're going to erase this kind of thing over here because I want to tell you a little bit more about what happens. So when a person has normal ability, it doesn't mean they never walk into a noisy place and they misunderstand. So I remember years and years ago when I didn't do this very much, but you go to a bar, right? And the bar is so loud that it's way over the speech levels. So when you think about speech levels, you're thinking of like 90, 100 decibels, and that's 100 decibels SPL, okay? And you're talking about a massive amount of noise, and sometimes in these dance places, 110, 120. I mean, you're talking about so loud. What you have to do is be up against someone's ear and scream bloody murder into it, right? That's what happens. So people who have normal hearing would test normally in this circumstance. What we find when we get up to these 100, 120 decibel kind of things, they struggle and they look like people with hearing loss. So if you don't understand what that is, that's exactly what happens. Those people, you would actually, when you get them up in this kind of range, they act like a person with a significant problem understanding in noisy places. Okay? So I want you to think about those. We'll say it this way. Some problem. Significant problem. Extreme problem. Again, these are not diagnostic things. Now, if you're an audiologist watching this, you're going, this is wrong. And calm down, okay? What we're not trying to do is give a diagnostic statement here. We're trying to explain. There's a difference between explaining something and diagnostically telling you about it. Let me give you an example in another way. I had torn my ACL on my left knee. Now, I didn't understand enough about this. Now, I'm an audiologist. I've studied anatomy and physiology. But I didn't get what it felt like. Now, one of the things that happened to me when I got hit in the back of the knee playing basketball, I was in the rebound position, got popped in the back of the knee, and nothing, he didn't do anything wrong with that, but he slightly dislocated it. It's called subluxating. So I'm laying on my side, because of the way I did it, and my knee is out of position, and I'm screaming bloody murder. And as soon as I roll over my butt, my knee goes pop, and it pops right in position, and all the guys are like, oh, dude. So the ACL is the knee ligament that keeps your knee in position. And when you don't have that, the cartilage starts to rub and rub off, and it is a very painful kind of thing. The one physician, the very first physician I went to, he's talking about things that we wanted to do. He was like, he finds out I'm an audiologist. He's like, hey, doc, he's talking to me as a doctor. And I'm like, okay, but I don't know enough about this. Like, you're a physician, you're an orthopedic physician, but you're not going to know about ears, okay? But I don't know your stuff. And he's talking about pig intestines with me. No, it's actually called an allograft that you could do in the knee. But I didn't know what that meant. We'd better do an allograft instead of an autograft. I'm like, what are you talking about? He's using diagnostic terms that he would write a report to another physician if I was referred from another physician to him as an orthopedic guy. And I'm like, I don't get you. And I walked out of there remembering pig intestines in my knee. Do you see, when you're an audiologist and you're talking to different patients, or if you're a patient walking into these places, you're looking at this going, why are you telling me stuff I don't understand? Okay? I mean, I'm not an audiologist. I didn't get a degree in this field to figure it out. And that's why we at Hearing Solution Centers spend time saying it in more reasonable terminology. So, when you have some problem understanding in noisy places, you might walk into that place and go, I'm really struggling to understand someone. And it gets worse when we have these stupid masks on the people. Because when you do this, you lose about 30 to 50% of all speech sounds. So this is why I'm really frustrated with this mask point. Because the visual cues are 30 to 50% of all cues happen, it's called speech reading. And we're trying to read that stuff. But we can see the intensity of the face. And it's the way the mouth goes and the way that the around the face, the muscles, and it's the eyes. But when you can only see this, you don't have a clue if they're angry when they said that, or if they're happy when they said that, or whatever. And you lose all the speech cues that are around there. And so when I have some problem understanding in noisy places, and some idiot's got her mask on, and she's trying to talk to me, I move into a significant problem understanding in noisy places. Like, what are we doing? And you're going to go, well, the pandemic and all this other stuff. And I'm like, listen, as an audiologist who has hearing loss, I understand that I'm part of American for Disabilities Act in 1992, which means that I'm exempt from having that mask issue. And the reality is, I need to have as much speech understanding, and I need to have the visual clues along with my hearing clues to make sense of it. Now, when we get into a noisier place, for me, I might move into a significant problem, even though I normally diagnostically only have some problem. When it gets a lot worse, I get really struggling. So for instance, a person, let me back it up in another way. Let's say that you had a significant problem understanding in noisy places. Remember that 7 to 15 range. What would happen to you is that if a little bit of sound happens, it gets really irritating. Let me tell you like in another way. When we bought a house, we bought a new house. We had our house in 2004, had it for a long time, had a decent dishwasher. It's okay. I mean, it was builder's level dishwasher, but it was frustrating. Every time my wife would turn it on, I couldn't hear the game. And I was always struggling with that puppy. When we got into this new house, I got a Bosch dishwasher. That was the one upgrade I couldn't care less about anything else, but I wanted to have the quietest little puppy in the world. That thing was so quiet. When I heard it, all I could hear is a shh, just a tiny little noise. And you'd hear the beep, 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 and that was the ending of it, right? And it didn't, but a person with a significant problem, with a little bit of a dishwasher, it totally disrupts the game that he's watching, let's say. Now, a person with an extreme problem understanding in noisy places, we're probably not going to do a lot of things to make them hear. When they're in those noisy places, are they going to understand the words? they probably are not going to understand much in those noisy places, and they're going to be focusing much more on the visual clues. And so when they walk in that noisy place, they can focus on that person, but they're really going to struggle if that person's not very clear. Now, it's funny when you talk about clarity. Some people mumble. They don't talk about this, and they're gonna have their cinnamon, you know. And I was mumbling that on purpose, right? But they don't really speak that well here. They might have, you know, they might chew with their mouth full, and it, you know, it's kind of gross to look at. They don't enunciate very well. I would learn to enunciate. I've been on stage. That's why I can do this. I've been on stage in theater. I've been on, you know, singing in front of a crowd. I was in front of 400 people and did one of my first solos ever without a microphone. I knew how to project with that too. So what happens is that some people have no clue about this kind of thing. And so when they have that, they have an extreme problem. Those people have an extreme problem, and they just never understand that guy. So if you are the family member of a person that has been told they have an extreme problem understanding in noisy places, you need to make yourself clear. And be clear. You don't have to like overdo it, but you just talk normally, but talk, you know, in a normal pattern so that they see the patterns, but you want to make sure that they don't look away. Because here's what happens. When a person has an extreme problem in noise, they might have a really bad understanding of words in quiet situations. I've had patients who did this. There was one guy very early on in my career. He said he would watch the weather and the guy would stop talking as he looked away. And I'm like, what are you talking about? I was like, I don't understand this. I didn't get it. I had to walk out of the room, and I talked to a friend of mine. And he goes, I think what is his speech understanding. I'm like, oh, got it. So when I walked back in the room, here's what he felt like. He was reading the lips. And as soon as the guy did this, he thought they were not talking. I'm like, no, they are too. No, they are not. And it was like this big, you know, he's pissed off at me. I'm like, so I got his wife in there. I'm like, can you tell him that, you know, he doesn't trust me. You tell him that they do speak on camera? She goes, yeah, they do. Really? That's the struggle that happens. You don't know because it gets that extreme in that way. But there are different ways as an audiologist that we do to help this stuff out. A couple things. When we have these kinds of problems, we do a couple different significant points. We have these things called directional microphones. Now, directional microphones have been around for a very long time, but they've gotten better and better and better. And there's ways of having adaptive directionality. And then there's all kinds of polar patterns that will actually occur. And so you're going, what are those? Don't worry about that. That's what the audiologist has got to do, okay? So there's ways of changing the directionality from behind you. So what we're trying to reduce the noise from behind you and focus on the stuff in front of you. But what we're trying to also do is sometimes we have to reduce the output. So sometimes we're reducing the super, super loud sounds because it's overwhelming to that person. And sometimes you also reduce the, what I call kinda loud sounds. Those would be the moderately loud sounds because you need to reduce that down to make it more comfortable for the person that's still here. But you still want to boost up the soft sounds, okay? So those are some of the ways that you do this. Now, you also have the ability of noise controllers in hearing aids. Now, here's the one thing that's happened. We get a lot of people who don't understand this, and I'm talking about dispensers and maybe even young audiologists. And they have never figured out that noise controllers don't mean that they take away all the noise. Let's give you a couple examples, and we'll end up on this one here. If there is just fan noise, that's going on around you, noise controllers can identify what that thing is and see that it's a very consistent fan noise and go and knock it down. But if we're talking about speech noise, here's what's happening. So we think about noise controllers and we're thinking about that circumstance. Well, let me give an example. My wife and I are in our first anniversary, well, it's before we get married, but we're in our first New Year's Eve party, okay? Or it's a, table. So we're sitting here at this table. I'm sitting right here looking at my wife, okay, or future wife at that point. And there are tables all around us, okay? Now, at the time, I had normal hearing. Now, I could hear her nice and easily, but this was really interesting for me because what I started to notice is a dude over here at this table here, and he was talking right here, was talking, and he was super loud. What we talk about is this concept of signal to noise ratio. Okay, so my wife is the signal, right? She wants to use what I want to hear. Now these are all noise, 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 but they're not too difficult to deal with. Now this is when I had perfect hearing. But then this guy gets louder and louder and louder, and he's drunk. That's New Year's Eve party kind of thing. And everyone's kind of like, and finally, one of the managers dismisses the dude because he is so loud. And we kind of go, kind of like, you can't hear. But we had to get rid of this guy because what he did is the signal should be at a plus. Let's say this person here is talking at 60 decibels, but this person here is talking at 40. So that means we have a plus 20 signal to noise ratio. That's pretty good, okay? But when that dude, if she doesn't keep speaking up loud enough, and he is now speaking at 80, which would be a very loud voice, and which is kind of what he probably was, we're now talking about a minus 20 signal to noise ratio. No matter what she did, even when she could speak up to 65, my wife doesn't speak that loud, we're still at a minus 15 signal to noise ratio. Well, I'm never going to understand her, right? And that's what happens when you get into those places. But see, sometimes when we have patients who have a real big problem, they can't hear the signal versus the noise. Now, by the way, both of these things are speech. Okay? If they're both speech, how does the body know that, how does the hearing aids and the technology know that you don't want to hear that person? Well, that person hopefully is behind you. So that's where we get the directional microphones. And hopefully we can do some things to help reduce that thing from behind us. But there are times when you get Mr. Drunk over here and he is going to be interfering with your circumstance. And so you say, I can hear him, but, I can't hear anything else. Well, it might be him. Okay? Now, if you have a circumstance where you can hear everyone else versus the person, your wife, for instance, in that situation, well, then that's something related to how the hearing aid is programmed, okay? And that's something that your audiologist can actually do. Hopefully they can do that. But that's something that we actually help take care of at Hearing Solution Centers. So, that just gives you a little understanding of noise kind of situations. Some of you are going, oh my gosh, this is big time. This is, way out there. But I'm trying to give you some of the details so that it gives you some ammunition when you're looking at this. And if you're an audiologist, I hope this helps you to understand some of the realities that private practice and real world audiology really goes through. So thanks so much for listening.